Good morning and welcome. This is Radio Doctor on Your Women Radio 91.7. 5 minutes after 10, and we're glad to welcome you to Nigeria's first specialized health program where medical doctors consult for free and advise on Your Women Radio 91.7. Radio Doctor is broadcast from 10 a.m. Mondays through to Fridays. I am Miracle Philip, and our radio doctor for today is Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. Good morning, Dr. Abiola. How are you today?
Morning. I'm doing very well.
Glad to have you join us.
Thank you.
On Radio Doctor today, Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital, will be consulting and advising on antibiotics, side effects, and benefits. Very interesting conversation that you'd want to listen into. So maybe there's someone that you want to get their attention to. They've always been asking you questions. Someone, get them to listen right now because we're about to delve into it and understanding better. So you don't go to that pharmacy or anywhere and someone say, take this one, take that one. You know that Dr. Abiola has showed you or shared with you what you need to know about antibiotics, the side effects and benefits. Don't forget that the phone lines also will be open for you to be part of the discourse. And the phone lines are 07000 917 917. Our toll-free number for women, 0800 1235 917. And then we have our SMS and WhatsApp line, that is 0703 175 6537. And that's how we get to do it today on the program. Listen to us live via our website, www.wfm917. In case you're bothered that maybe your frequency is shaking and it's doing one kind, you can listen via our website. Or you can also follow us across our social media platforms on Facebook, on X, on Instagram, on YouTube at WFM917. All right, Dr. Abiola, what are antibiotics and how do they work in the human body?
Yeah, it's an excellent topic. Antibiotics are medications designed to either kill or to slow the growth of bacteria. And they usually target bacterial cells while hopefully sparing human cells. Right? And there are so many different classes of antibiotics available, but We'll talk more about that later. But infections like pneumonia, urinary tract infection, and sepsis, which is a blood infection, can effectively be treated with antibiotics. I have a trivia question for you.
All right. Thank you very much.
I have a trivia question for you.
For me?
Yeah.
Okay.
When were antibiotics first discovered?
Dr. Abiola, I'll be honest. The year, I don't know.
Yes. 1928 by Alexander Fleming. 1928.
1928. Interesting.
And
that's a very long time.
Since he was seeing a 20-fold reduction in deaths from bacterial infections since their introduction. Very important class of medication.
All right. Thank you very much, Dr. Abiola. Dr. Abiola, I would also like for you to speak up a bit. It seems like you're a bit far, so we're not able to hear you loud and clear. All right.
Any improvement? Is that better?
Yes, perfect now. Perfect.
All right.
All right. So, Dr. Abiola, why are antibiotics considered as one of the most significant medical discoveries of all time?
Well, antibiotics, like, maybe you couldn't hear me well, 1928 when they were discovered. Since then, antibiotics have revolutionized medicine, reducing deaths from bacterial infections. And before antibiotics, things like TB, tuberculosis, pneumonia were the leading causes of death. So, and that's true through much of the 1800s and 1900s. So people typically died from infections. people never lived old enough to die from, like now, we're dying from heart disease and cancer. People oftentimes didn't live that long enough to suffer from those. So antibiotics has increased our life expectancy, reduced deaths from bacterial infections, and really changed the way we live. The first really widely used antibiotic was something called penicillin. And during World War II, that's in the 1940s, that was used. It was mass-produced and saved countless lives. That was one of the biggest test runs for antibiotics, and it was very useful. It's estimated that 200 million lives a year are saved by using antibiotics. 200 million lives a year worldwide.
Wow. That's very interesting. And considering, some of these ailments that you shared, have been linked with antibiotics, can you explain the difference between antibiotics and other types of medication?
Yeah, very, very good question. Antibiotics target bacteria specifically. And there's some bacteria. One of the ones we've heard of, staph, strep, E. coli, all of those are bacteria. It's just a type of pathogen. Whereas you have another class of medications called antivirals, and antivirals target viruses. The viruses like HIV, hepatitis, etc. And you even have things like antifungals, which can address fungal infections, and none of them cross. So it's not like you can use an antibiotic for a fungal infection, neither can you use a antifungal for a bacterial infection. They're very specific because they target the specific organism.
All right, thank you very much.
A lot of questions I get all the time is like, which antibiotic should I use if I'm suspected somebody with HIV? Okay. Maybe I slept with somebody that has HIV. I get that question all the time. Which antibiotic should I use? And the short answer is none, because HIV is a virus, and so an antibiotic will not do anything. But you'd be surprised how many people in this environment and worldwide, how many people want to run to an antibiotic to save them in that case, and it's just not the case.
Wow. Thank you very much, Dr. Abiola. I'm even very particular about the fact that you're stressing that it's for bacterial sort of infections, and there's a lot of misinformation everywhere. People just, this thing is disturbing you, this one is doing, and you go and get antibiotics just like that. Now, does it also mean that it's just strictly the bacterial infections or diseases that antibiotics are very effective in curing?
Very, very true. Yes, it's the bacterial infections. Some of them like strep throat, TB tuberculosis is a bacterial infection. Often, most skin infections are also bacterial and can be treated with antibiotics. And one of the things we see often, or a good example, if somebody has cold symptoms, fever, cough, catarrh, those kind of things. It could be, in this environment, that could be malaria, that could be a bacterial infection like pneumonia. It could also be a virus like rhinovirus, which causes cold symptoms. So if you always run to an antibiotic, you notice I mentioned 3 different types of infections there. Antibiotic only takes care of one of them. Antibiotics do not work for malaria. Antimalarials do not work for bacterial infections, so forth and so on. So it's important, before you just start using an antibiotic indiscriminately, to have a test to know exactly what you're treating.
All right. Thank you very much, Doctor. And I like the part of saying, please go do a test so you know what you are treating, because these days people just assume, people just think it up in their head, and we even see these things happen when people go to maybe pharmacies. They'll tell you, what is it? Okay, this is what is happening to you, and it's a problem. So that's why we've been having this discussion right here for proper education. 10:15. Okay, Doctor, you want to say something?
Oh, after you finish the break, I'll give a story.
It's 10:15 on Your Women Radio 91.7, and we have with us Dr. Abiola Ajayi. He is the MD and CEO of ROA Specialist Hospital, and we're discussing. He is going to be consulting with us on antibiotics, side effects, and benefits. All right, Doctor.
When I first started this practice, I wasn't busy, so I used to spend time. I would drive to different pharmacies in the area and just hang out with them, just to kind of see and just to create camaraderie. And I saw the strangest thing on one of my visits. Somebody came in and said, please let me have, and he named a particular antibiotic. Let me have so-and-so. I just feel like I need to flush my system. And the so-called pharmacist, whoever was manning the table, said, "Oh, how many do you need?" He said, "Oh, just one. Just one. Maybe one or two." And I just recoiled in horror. I didn't say anything, but then I realized that ignorance is our number one. It's our number one problem. Yeah. That's probably the worst way to use an antibiotic, because you not only ruin it for yourself, but you're ruining it for other people by promoting something called resistance. And I think we'll talk about that.
Cool. Thank you so much, Doctor, for citing that example. And I hear this a lot. People using it to flush out their system. It's the way they say it. And this is something that they've heard over time and passed down to their children. It's a lot.
Exactly.
I'm so glad we are discussing this today. It's a total overhaul of what anyone would have ever thought that antibiotics was for. Now let's even go closer to the benefits, the primary benefits of antibiotics in treating infections.
Yeah, the main benefit is that they can usually, for example, if somebody has an infection, either they have a rash or they have a boil. Let's use the boil example. It can be painful, so antibiotics can help alleviate those symptoms: the pain, the redness, the warmth. And one other thing that's extremely important is that it helps prevent the spread of the infection. So you can start off with an infection on the skin or what we call soft tissue. And if you're not careful, it can now spread into your bloodstream, causing sepsis. Sepsis can lead to death, right? So you may not die from the initial infection, but if it enters your blood or goes to another organ, then you're in a lot of trouble.
Wow. Now that's scary.
The sepsis treatment with antibiotics, that's been treating blood infections with antibiotics, has reduced global deaths by 52% in the last 20 years. The usefulness of them cannot be understated or cannot be overstated. And that problem about resistance is something that we'll really have to talk about shortly.
All right. Thank you very much, Doctor. Are antibiotics essential in surgical procedures?
Extremely.
Wow. Why?
Extremely essential. Almost every surgery almost every major surgery that we do, we use antibiotics even before the surgery. So it's to reduce the chance. One of our largest organs of the body is the skin. Not one of the largest organ of the body is your skin, and your skin is your primary defense from pathogens or from bacteria. So when you do surgery, inherently you break the skin, you cut the skin, and you've now opened the way for bacteria to get into your internal tissues. So to prevent that, we call it an SSI, or a surgical site infection. To prevent those, we use prophylactic or preoperative antibiotics, and they've been crucial, reducing infections by 85% in most cases, and obviously reducing death from surgery.
Wow. Interesting indeed. Thank you very much, Doctor. I would like to look at post-surgical care too. What role does antibiotics play, and how can patients follow their prescriptions properly?
Yeah, in post-surgical care, it's extremely important. Even though you've closed the wound, you do not want that wound. When I say wound, it's the wound the surgeon created, right? You don't want that wound to now get infected. If the wound gets infected, it delays wound healing. And if you have delayed wound healing and the infection persists, it can get into the blood, causing sepsis, and then the patient could die. You can see patients after a successful surgery still die because of post-operative infection. Right, so it's and that happens all the time. Maybe the antibiotics were not given, or the patient didn't take it properly, or they didn't know what signs of infection to look out for. All of those play huge roles in post-surgical care. Patients should always complete the full course of medication to prevent infection reoccurrence. And if the drug is meant to be taken every 8 hours, you need to take it every 8 hours. If that 8 hours falls at 2 a.m., you should weigh the risk and benefit. Is your life worth waking up and taking your medication, or do you want to risk it and wait? Anytime you're not using the medication properly, you're setting yourself up for resistance. And the easy way to describe resistance, let's say you have 10 bacteria. Those 10 bacteria are enough to make you feel sick or to cause an infection. Then you start taking antibiotics, and antibiotics kill 5 of them. By the time there's only 5 left, you start feeling better, and you stop the antibiotics instead of continuing it like your doctor prescribed. Now, those 5 that are remaining have seen that antibiotic very well, and they've come up with strategies on how to defeat it. So now those 5 continue multiplying. They become 10. You feel sick again. Oh, you're now run back to that antibiotic. It's not going to work because the bacteria are now resistant. They've seen it. They know all about it, and they know how to defeat it. So now you either have an infection that could lead to death, and your doctors are scrambling to find another antibiotic that will work. And you don't always find an alternative. So patients should always complete the full course of their medication, even if they feel fine, and make sure the timing and the dosage is critical. You don't want to take, another thing I see is that somebody's taking a drug, an antibiotic, and they say, I'm not feeling better. Let me, instead of taking this thing 1-1 like the doctor said, let me take it 2-2 and see. That's also very dangerous. Overdosage, all these things are toxic either to your liver or to your kidney in most cases. So you could be causing yourself a lot more harm when you're doing things like that. So right dose, right time, and finish them completely.
All right. Thank you very much, Dr. Abiola. The emphasis on following doctor's prescription, very important. And I mean, the fact that you also spoke to the abuse of the antibiotics by people who feel, it's not working immediately, let me just take that's overdose. If you've just tuned in, this is still Women Radio 91.7, Nigeria's first and only radio station for women and their families. We have with us Dr. Abiola Ajayi, who is the MD and CEO, ROA Specialist Hospital. And he is consulting with us for free on antibiotic side effects and also the benefits. Don't forget that you can get to call in, get to ask your questions. Maybe someone has misinformed you and you want to seek clarity from Dr. Abiola about the use of antibiotics. The numbers are 07000 917 917. 07000-917-917. We also have our toll-free number for women, which is 0800-1235-917. 0800-1235-917. Our SMS and WhatsApp line is also available, and that is 0703-175-6537. All right. We proceed with this conversation, and I'd like to ask Doctor, how can families and caregivers also help patients follow their post-surgical antibiotic prescriptions?
Yeah, one of the major things caregivers can do, besides just support the patient emotionally, is that you can set a reminder. We talked about the timing of the medication is when you take it is important. So your caregiver, family member can set a reminder for the medication. They can also ensure that the medication is stored properly. There's some antibiotics that need to be refrigerated at all times. And family members can. I know I was taking care of a sick family member, and I used to have to do that often. Take the antibiotics out of the fridge, give them, and put them back. And you can also help ensure that the patient adheres to any dietary restrictions. There are some drugs and some antibiotics you don't take with milk, or you don't take with minerals. Some of them have some peculiar traits, and the family and caregivers can help remind of all of those.
All right. Thank you very much, Dr. Abiola. Very important for family members to help and support these patients to get through with their medication. Dr. Abiola, I would like to ask, are there some sort of misconceptions as well that you have heard about and the use of antibiotics in the years of your career?
Oh, plenty. One of the ones I started off by saying that people try and use it for viral illnesses or HIV. The another one is that people feel like, oh, my neighbor was coughing, I'm coughing, their doctor gave them some antibiotic. Hey, do you have more of it, or what's the name of the one that you use? And try and go and get it. That happens often, and you have to remember that antibiotics are specific to the bacteria, or try to be, at least. Most of them try to be. So somebody may be coughing because they have malaria. Somebody may be coughing because they have pneumonia. Somebody may be coughing because they have a virus. You can't just copy their prescription and think it's going to work for you. And the main other one is that you stop them. You stop them when you start feeling better. That's an absolute no-no. Absolute. Those are the main ones that I see on a daily basis.
Very interesting indeed, and I know that there are lots of people who would actually take in with this too. I get to hear this even with other medications. Someone sees someone making use of a medication, and just because it's something that they also have to deal with, they're like, oh, it's the same thing now, let me use it. And they don't even take into consideration that it's it's your different body, and you really need to rely on prescriptions, which often, that's the reason we have to go to the hospital, because you need to get personalized prescriptions for you. And this can only come from, a medical personnel who has gotten to listen to you, share with them what is going on in your body. Thank you so much, Dr. Abiola.
Yes, my pleasure.
28 minutes past 10. On Your Women Radio 91.7, and we have with us Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. And then we're getting to have this conversation together. Now, doctor, there are some people who feel like, having to use and overuse antibiotics does not have any particular effect on them.
Say that again. Having to
overuse. So, like you said, you painted the analogy that someone takes it and says, "Oh, I don't think it's working," and then there are people who get to maybe go against the dose, and they're like, "Okay, I'm taking the dose now. I've been taking overdose. I've not been taking my prescription. I've not had any side effects. It's working for me."
Yes, that's I understand the analogy, and that happens often. You have to remember that the side effects, you may not see the side effects right away. So one of the most common side effects of using an antibiotic is stomach issues or gastrointestinal issues, meaning diarrhea and or constipation. But if you don't see that diarrhea, it doesn't mean that other things are not happening. For example, everything that goes into your body must pass through your liver, goes through your mouth. So any drug you're taking, your liver has to break it down and detoxify it. And at times that can cause liver toxicity, can even cause liver failure in some cases. The kidneys the same way. There's some medications and some antibiotics, for example, an IV antibiotic called vancomycin can destroy your kidneys, especially if it's not dosed properly. So, yes, I wouldn't want people to have that feeling that because they don't feel anything or anything bad, that nothing bad is happening. Everything has side effects. Everything has the condition where you need to weigh the risks and the benefits, and you try and do things that are beneficial for the patient.
All right. Thank you very much, Doctor. And I do hope that people have taken note of this. Don't forget, you get to be part of the discuss and ask whatever questions you have for Dr. Abiola this morning. The phone lines are 07000 917 917, 07000 917 917. Our toll-free number for women, 0800 1235 917. And then our SMS and WhatsApp line, 0703 175 6537. Doctor, what happens if a patient is allergic to common antibiotics used in surgery?
Yeah, at first, every allergy is not life-threatening. So there's some allergies that it may just be a rash. And there's some allergies that can cause something called anaphylaxis, which is it's a severe reaction where people their windpipe can slow down, or they can have difficulty breathing, or it can close off completely. You can have rapid loss in blood pressure, and so many. So you first need to determine which of the allergies is it, and if it's one of the minor ones, is it beneficial to the patient to continue and just keep monitoring, or oftentimes we can prescribe alternatives, right? But it's not. We don't have an endless list of alternatives. So in that case, especially if a patient is resistant to multiple drugs, there's even a way to desensitize the person to allergies, where under medical supervision, we give smaller doses. Over time, the allergic reaction reduces. But the simple answer to the question, if you have an allergy, please report it, or if you suspect to have to report it immediately to your doctor, and they may prescribe an alternative for you at that time.
All right, thank you very much, Doctor. It's very important for patients to call the attention of their doctors so that they are well aware of what's happening within their body, especially if they are reacting like we have shared right now. Doctor, are there particular risks and consequences of skipping or misusing antibiotics after surgery? I'm looking at it, especially skipping. There are people who overuse, do overdose, and then there are people who do not use it to the extent which has been prescribed. Are there risks and consequences for this?
Yes, when we say misuse of antibiotics, that includes skipping doses, or stopping the treatment prematurely, or taking them without a prescription. All three of those can lead to serious health consequences, not only for the patient but for society at large. We're still going to get more into resistance, but we have to have, it's called stewardship, or antibiotic stewardship, meaning that we all have to protect the use and the potency of our antibiotics and use them properly for our benefit and for the benefit of others. The individual that is prescribed antibiotics after surgery and misuses them may end up with something like a wound abscess, or or septicemia, which is an infection in the blood. Skipping doses can leave residual bacteria in the body, which can allow the infection to come back. And usually when the infection comes back, it comes back more severe. After surgery, antibiotics are extremely important. In Nigeria alone, 20% of people that are readmitted back to the hospital after surgery for post-op infections post-op infections are implicated. Let me say that better. When somebody has surgery and they go home, sometimes they have to come back and they're readmitted into the hospital. 20% of the time it's because of poor use of the antibiotics, right? So 1 in 5 patients. Misuse can also prolong your recovery time, right? So, and then patients that skip antibiotics have shown that they have a 30% higher chance of complications, post-op or post-surgical complications. And then the final one is misuse promotes survival of resistant bacteria. So this makes future infections harder to treat. And something that happens that I witnessed in the U.S., there's a bacteria that came up called MRSA, or methicillin-resistant Staphylococcus aureus, right? Long-term, but Staph aureus lives all over on our body. It typically lives with us, and if it were to cause an infection, there are a lot of antibiotics that would work until this particular strain of bacteria came out. Some people call it a superbug, and it's highly resistant to conventional antibiotics. And you can catch some of these infections in the hospital. So if a patient, sometimes you come in to treat one infection and you leave with a different infection, or you encounter another infection because you're in an environment where a lot of infected people are, and you would not want to catch an infection or get introduced to a bacteria that's resistant to most antibiotics. It's a miserable experience. I've witnessed it firsthand. You oftentimes end up in the ICU, and death is a real occurrence.
Ooh. This is really scary, but I'm glad that we're talking about it right here, Rick.
You know, I like the statistics. In Nigeria now, already 38% of bacterial infections are resistant to first-line antibiotics. So it's because we've misused. You know, anybody can get any type of antibiotic.
Yeah.
People use it anyhow, and it's showing. So there's actually, and that was part of the study, is in 2017, 2019, and 2023, did studies of how Nigerian infections are responding to antibiotics, and our resistance rates are climbing through the roof.
Ooh. Now that's a lot, and that is to say that we really need to take our medications right, take the antibiotics right. Thank you very much, Dr. Abiola. If you've just tuned in, this is Radio Doctor on Your Women Radio 91.7. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advice on Your Women Radio 91.7. Today we have with us Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. He is advising and consulting on antibiotics, side effects, and benefits. And it's been an interesting conversation so far, but we are not done. If you do have any questions that you want to ask Dr. Abiola this morning, the phone lines are 07000 917 917, our toll-free number for women 0800 1235 917, and then we have our SMS and WhatsApp line 0703 175 6537. Okay, Dr. Abiola, how have antibiotics contributed to reducing mortality rates globally?
The studies that I saw since 1940, antibiotics have reduced bacterial infection-related deaths by over 70%. By 70%. So. And that's worldwide. There, like we mentioned before, some of the most impactful medical intervention in human history was the development of the antibiotic. And between 1940 and 2010, we showed that the introduction of antibiotics reduced infectious disease deaths by over 60% worldwide. That's from the WHO. And some specific diseases have really been tackled with antibiotics. For example, pneumonia have reduced pneumonia deaths by 85% since the 1950s. TB deaths have reduced by 40% since 2000. And 26% of deaths by newborns worldwide have been reduced by antibiotics. So all age groups, young adults and old, everyone is benefiting from the use of antibiotics worldwide, the proper use of antibiotics worldwide.
All right.
There were studies in Nigeria showing too that there's something called meningitis that we used to suffer from a lot here. Yes, we've reduced the deaths by 35% in just the last 10 years. And in the U.S., we attribute about a 7-year increase in life expectancy because of the proper use of antibiotics.
Quite interesting, Doctor. I would like us to look at chronic conditions. Are there particular chronic conditions that antibiotics support the treatment of?
Yes, the short answer is yes. Antibiotics can reduce the infection risk. You know, we talk about chronic conditions, talking about people that may have diabetes, cancer, or even a weakened immunity like HIV sufferers. The use of antibiotics will improve recovery, will reduce infection risk, and for those that have weakened immunity, for example, HIV or AIDS does not kill the patient. Normally it is an infection that they get because their immune system is so depleted. It's that infection that kills them. So you see a lot of AIDS patients die of pneumonia, where a normal person wouldn't die of pneumonia. They die of pneumonia, and because their immune system is just devastated. So antibiotics can reduce not only the risk but improve recovery in people like that and others.
All right. Thank you very much, Doctor, for answering that question. It is still Women Radio 91.7, and we have with us Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital, and he is consulting and advising on antibiotics, side effects, and benefits. Dr. Abiola, even looking at, making use of antibiotics in treating infections, are there side effects associated with taking antibiotics?
Yes, antibiotics, even though we credit them for being life-saving, they can cause side effects. Some of the side effects can range from mild discomfort all the way up to severe reactions. So understanding these side effects can help patients recognize when more medical attention is needed. Some of the mild effects are, I mentioned before, gastrointestinal disturbances. So what does that mean? Nausea, diarrhea, vomiting, and abdominal pain. Up to 20% of patients on some particular antibiotics experience mild GI issues. Still under the mild side, allergic, under the mild allergy reactions like rash, itching, or hives. And in some rare cases, anaphylaxis, like I told you, where people have difficulty breathing. And you typically see that with things like penicillin and things based off penicillin. Those are some of the mild ones. Mm-hmm. And like I said, the severe side effects can all lead to death. Some of them can cause, you can even get another type of infection. There are some antibiotics that have a rare side effect where your tendons can rupture, and that antibiotic is one that's used oftentimes in Nigeria. And then, like I mentioned before, kidney and liver damage, can really affect the liver, especially in older patients, and especially in those that have pre-existing conditions. So imagine, we talked about somebody with diabetes. Using antibiotics can be great because it can help reduce the infection and improve their recovery. But somebody with diabetes also oftentimes has reduced kidney function. So you have to make sure that the antibiotic you're using will hopefully not affect the kidney, and you need to make sure that by the time you finish treating the infection, you don't leave the patient with kidney failure. And honestly, I saw that recently in a patient that I was treating in the States. Severe infection, had to use a pretty strong antibiotic, and by the time they finished, he's in kidney failure. So, but at those times you have to measure the risks and the benefit, either lose the patient or save them.
All right. Thank you very much, Doctor, for sharing this with us, and very well taken note of. Are there specific groups of people who are more prone to experiencing these severe side effects from antibiotics?
Yeah, there are different populations at risk. The three most important: elderly. So elderly patients are more prone to have severe side effects like kidney damage, right? Because typically elderly will maybe have high blood pressure, which affects your kidney, diabetes, which affects your kidney, and on top of that, if you now put a very strong antibiotic, it can leave you with kidney damage. Pregnant women taking antibiotics can harm the fetus, cause birth defects, or even kill the fetus. Right, so there's certain antibiotics you do not use in pregnancy, and for those reasons. And the third group, immunocompromised. People that have some chronic disease or some reason why their immune system is weak, they may experience even more intense side effects because their immune system is so weak. So those are the main populations at risk. Everybody can be at risk, but these ones are more specifically at risk.
All right. Thank you very much, Dr. Abiola. 11:45 on your Women Radio 91.7, and this is Women Radio 91.7. It is Radio Doctor. We have with us Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. He is consulting and advising on antibiotics, side effects, and also benefits. And you get to be part of this. If you do have any questions for Dr. Abiola, the phone lines, you can get to reach us via them, or you can also reach us via our SMS and WhatsApp line. The SMS and WhatsApp line for any of your questions, 0703 175 6537, and then also our toll-free number for women as well. I'll take this call here. Alright, please just move away from your radio set. Okay, please, you have to call us back, okay? When you do call, ensure that you move away from your radio set. This will help us to hear you perfectly well, okay? 07000 917 917. 07000 917 917. Toll-free number for women, 0800 123 5917. 0800 123 5917. And then our SMS and WhatsApp line, 0703 175 6537. Now, Dr. Abiola, how can taking antibiotics disrupt the body's natural microbiome, and what are the consequences?
So the body's natural microbiome is the bacteria that live with us normally, right? So we have a lot of bacteria that live on our body, that live in our body, and a lot of them live in our GI tract or our gastrointestinal tract. So that's your small intestine, large intestine primarily. Taking antibiotics can kill, of course, harmful bacteria, but can also kill the beneficial bacteria, which is usually the number one cause of the diarrhea that you get when you take antibiotics, because you've killed the beneficial bacteria. Sometimes you kill it and other bacteria can now grow, and those lead to diarrhea, or yeast or fungus can now grow because there's less bacteria in the area. So this is why you have to, we call it, use your antibiotics judiciously. It's not everybody that requires antibiotics. It's not every state that requires antibiotics. There's something I see here in Nigeria all the time. When somebody's stomach is running, they want to, as soon as there's running stomach, loose stools, or diarrhea, they're running to get a particular antibiotic that starts with an F, right? We all know it. And the number one side effect of that antibiotic is running stomach. So I don't understand how people would and there's other alternatives to reduce diarrhea that are not antibiotics. But we see it. The first driver I had in Nigeria did it. I've seen patients do it 1,000 times. It's it can affect your natural microbiome, can affect your health, it can even affect your happiness. The bacteria that are in our gut produce something called serotonin. Serotonin is responsible for mood, sleep, so many different regulatory processes. So misuse of antibiotics can affect those natural bacteria and could lead to sadness, depression, anxiety. It is possible. It is possible.
Well, that's a lot to take in, thinking that misuse of antibiotics can affect whether someone is happy or not. All right. Yeah. We're taking note of this, doctor, and that is why we are even having this discussion in the first place, because every day we learn. Well, you know that Dr. Abiola Ajayi will say it as it is, so make sure that you take note. All right, so right now we have 5 minutes to go as we, engage this conversation with Dr. Abiola, and there's been so much that we've been able to look at today. Everything about antibiotics, how it works in the body, the medical discoveries and what makes it stand out actually, how different it is from, other medications. I love the part where doctor was saying, don't just go and just say, this one is happening to me and I'm taking antibiotics, and then you get it prescribed, or you personally prescribe it to yourself because you see somebody taking it and you're like, what's the name? And let me go and look for it, or let me go and look for another type, as long as it's antibiotics. it's become a norm. And I'm even so happy for how we get to reach down to as many people through Radio Doctor, because it becomes really impactful and also educational as well. Now, Dr. Abiola, as we wrap up, how should antibiotics really be taken to ensure their effectiveness and minimize risk?
Yeah, you want to follow a few guidelines, and those are follow your prescriptions exactly, where you're always taking the specific dose at the specific time interval, right? So the reason why you do that is because you're trying to maintain effective drug levels in the bloodstream. Any drug you take, your liver and kidney and the other process are trying to break it down. So if you take 500 milligrams, in 2 hours, only 200 milligrams may be left in the body. 2 hours later, maybe only 100 milligrams is left in the body. So this is why you now have to increase the dose, because it may take 500 milligrams to kill the bacteria, and anything less than that will promote resistance. Missing doses can reduce the effectiveness by up to 50% because it allows bacteria to survive and to adapt. So follow your dosage and your timing. Also complete the full course. Stopping early, even if you feel better, leave some bacteria alive, which increases the chance of resistance. And studies show that worldwide is 1 in 3 patients fail to finish their antibiotics. Studies in Nigeria show that it's almost 50% of us in Nigeria fail to finish our antibiotics, which can result in recurring infections and, like I keep saying, resistance. And then taking it with or without food as directed. There's some antibiotics that work better with food to reduce stomach upset, and there's some others that are less effective if you take them with meals that are high in calcium, and there's some that are affected by fat. So really, you should follow those instructions, and especially if there's a food related to it, follow that. Avoiding alcohol is another one of the guidelines. Alcohol can interact with certain antibiotics, can reduce effectiveness, can cause side effects like nausea and dizziness, and in some cases, some antibiotics plus alcohol can trigger severe vomiting and severe reaction. So you do not want to drink while you're using antibiotics. And then the final one I would probably say is do not share or reuse antibiotics. So you don't want to use someone else's medication, and you don't want to, these people that stop, they finished the antibiotic early. They didn't finish it, but they stopped using it early. And then the next time they get sick, they want to just start that same antibiotic again. Those are no-nos. Those are all poor things to do. So those are some of the missteps to avoid.
Thank you very much, Doctor. And you really just made it clear. I've also heard people say things like, make sure that you're taking your antibiotics with food. Sometimes I've gotten prescription and I'm like, ensure that you take. While I don't understand that, I've not had to even ask, but I think I have better understanding of this now with this conversation. So thank you, Dr. Abiola.
My pleasure.
All right.
Thanks for having me.
Thank you too. And just so also, in 1 minute, what would you say to someone out there who maybe have encountered people who are spreading this sort of misinformation about the use of antibiotics?
I would tell everyone antibiotics are powerful allies when used correctly. They can save lives when used correctly. Used incorrectly, they can harm or even endanger lives. Always take them as prescribed, complete the full course, and consult your doctor with any concerns.
All right. Thank you very much, Dr. Abiola, for joining us on the Radio Doctor today. It's been such a pleasure having you with us. It's also been very enlightening as well. Dr. Abiola is the MD and CEO of ROA Specialist Hospital. For consultations, you might want to grab a pen and a paper to get this one. You can reach Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital on 0913 579 5108. 0913 579 5108. Or you can also book an appointment and also get directions as well via this line. It is 0816 601 4901. 0816 601 4901. I'll take that again, 0816 601 4901. Dr. Abiola, people want to reach out to you via your socials. All right. Okay. So for you to reach out to Dr. Abiola on his social media platforms, it's Facebook, ROA Specialist Hospital, Instagram, ROA Specialist Hospital, YouTube, ROA Hospital, X, formerly Twitter, ROA Hospital, or you can visit www.theroahospital.com. Thank you all for listening as well. Radio Doctor is Nigeria's first special